The session is in English and will last for 90 minutes. Feel free to post your questions in the Q&A session at any time during the session, and they'll be responded to as much as possible. There will be pop-up polls as the webinar progresses. Participants are encouraged to tweet during the session under hashtag AHB 2022. To highlight the session agenda, we'll have 4 panelists, a moderator from Africa at Business, 3 speakers from Ncd Alliance, Novartis, and Ncd Child. Thereafter, we'll have a Q&A session, party shows from the panelists, and finally concluding the webinar. And now, let me introduce the moderator for the day, who has demonstrated his story of not only working as a medical doctor, but also passionate about volunteerism, health leadership, and governance. This has seen her serve in a number of youth-led organizations with acquired skills in global health advocacy, project management, and research. In addition, she has received 2 awards this year: the Rising Star Award for the Zenith Global Africa Healthcare Awards, as well as Zuri Foundation Young Achievers Award. She is currently serving as a project manager at Africa Health Business. Ladies and gentlemen, Dr. Marie-Claire Wangari.
Thank you so much, Victor, for that wonderful introduction, and welcome everyone to the first webinar as we kick off the 2022 webinar series of Africa Health Business, where we will be focusing on how we can reinforce our health systems with a special focus on primary healthcare systems in tackling the rising non-communicable disease pandemic. So before I introduce our lovely speakers this afternoon, I'd like to set the stage on why we picked this topic of non-communicable diseases and why we are focusing on primary healthcare systems. So for many of those who are frontline healthcare workers, at the height of the COVID pandemic, a lot of non-communicable diseases clinics like hypertension clinics, oncology clinics, and so on and so forth were closed just in a measure of trying to contain the COVID-19 pandemic. But then we soon realized that COVID can find you anywhere, whether you're in the hospital or whether you're doing home-based visits. And if you look at it from a policy lens, or if you look at it from statistic lens, for those who like numbers, you'll realize that the WHO Africa Regional Office in the year 2000 did come up with a non-communicable disease strategy. I stand corrected, but that strategy has not been revised 20 years later, probably due to the new onset of the new public health order by the Africa CDC. But in the year 2000, 61% of deaths were due to non-communicable diseases. And in 2019, just before COVID hit, the WHO reported that 74% of deaths were due to non-communicable diseases. And the biggest gap we found was probably in investments. And it was found it was even mentioned last month during the International Strategic Dialogue on NCDs and SDGs that was hosted by the WHO Afro office in Ghana, that 7 million lives can be saved if you just updated your global investments by 0.85 US dollars. So you don't even need a dollar, just 0.85. And this will increase your total investments to as an upwards of up to even 230 million US dollars. So with all that in mind, we are having these wonderful panelists who will be sharing their expertise, especially as we gear up to the World Health Assembly, which is next week, which also has an agenda on non-communicable diseases, tentatively put as Agenda 14, focusing on 1 billion more people benefiting from universal health coverage. Without further ado, this leads me to introduce our first speaker for today, who is Ms. Tololupe Oshibe-san. I hope I got that right. Or Tolu, as some of us who have interacted with her call her. So Ms. Tololupe is a pharmacist by training based in Geneva, Switzerland, and she is currently the Senior Policy and Advocacy Officer at Ncd Alliance. She has worked on the prevention and control of non-communicable diseases at national and global levels. Currently, she's working with supporting development of healthy populations and communities, as well as developing nations and highlighting the plight of communities from an NCD lens, especially marginalized communities and even people living with disabilities. She's a primary healthcare enthusiast, and currently she serves as an executive board member at the African Forum for Primary Healthcare, Afro-PHC. So welcome, Tolu, to give us your opening remarks. and then we can take it from there. Thank you.
Thank you so much, Mary Claire. Good morning, good afternoon, and good evening, distinguished colleagues. It's always a wonderful opportunity to meet with you and share. I thank you very much for the opportunity to speak today. As Mary Claire has rightly said, my name is Tolu, and I'll be presenting with you over the next few minutes what we know in terms of the policy landscape for non-communicable conditions. So I will describe the global level policy, and then we'll look at what we have in place for Africa. If I may have the next slide, please. And just by way of introduction, for those who may not know the Ncd Alliance, it is a global civil society network. And our work is to see a world where everyone is free from preventable non-communicable conditions. The Ncd Alliance was formed in 2009. So for 13 years, we have grown in leaps and in bounds to now have members spread across 80 countries. We have a network of foot soldiers, which we call the national or regional alliances, and we have 66 different ones. So we think it's an impressive achievement. And by the way, some of our strongest alliances are within the African region. So we're happy to see that there's that zeal to see a change, not just from the people on ground at the country level also. Apart from our alliances and the work we do with the UN, we work with several other organizations. We work with the private sector, we work with foundations, with academia, and with other bilateral organizations, just to make sure that NCDs continue to occupy a relevant space in the health agenda. Now, let's move on to the next slide, which introduces non-communicable conditions at the global level. So I've added a small image to share with you the 5 major non-communicable conditions and the 5 major risk factors. So for those who may not be familiar with them, these are the 5 major ones. You will agree that everybody knows someone who has suffered from them or who has died for them in recent times. So they continue to be a threat to health and development goals. In 2019, like Mary Claire rightly said, we noted that the WHO documented that 71% of people, were dying annually from non-communicable conditions. Unfortunately, over the past 3 years, that figure has risen to about 74% of deaths due to non-communicable conditions. And I think the most devastating part is that many of these deaths occur before the age of 70 years. And so they are described as premature mortality. So out of 41 million deaths in 2019, for example, 15 million happened between ages 30 and 69. And to bring it further home for us who are in low and middle income countries, out of these 15 million deaths, 85% of them occurred in low and middle income countries. So we continue to see a rise in premature mortality from non-communicable conditions in low and middle income countries. Now, to look again at the major conditions, we have cardiovascular diseases, cancers, chronic respiratory conditions like asthma and diabetes, accounting for 80% of premature deaths. And that's why they are described as the major as the big four, as some of you may be familiar. And heart disease continues to be the leading cause of death globally, and they've been in that position for the past 20 years. Again, adult obesity is on the rise. And when we think about obesity, it's not just obesity. There are several conditions such as diabetes and mental health conditions that go hand in hand when we have things like obesity. And finally, just to wrap up on what we have in terms of the statistics, death from diabetes increased by 70% globally from the periods of 2000 to 2019. And we saw an 80% rise in deaths due to diabetes among males in the world. So we see it, like Mary Claire has said, there's a disturbing trend, and this is a rise in non-communicable conditions, not just in high-income countries, but in low and middle-income countries. If I may have the next slide, please. Now, I will just describe for us what we have in place in terms of the policy landscape in Africa for non-communicable conditions. In 2000, the WHO Africa region developed a strategy for non-communicable conditions. They focused on it because it was of public health importance. And as at that time, they accounted for they accounted for less than 50% of deaths. As at that time, the estimate was that in 2020, they would account for 60% of deaths. But if you reflect on what I just said earlier, we are now at a stage where NCDs account for between 71% to 74% of deaths, over between 2018 and now. So we continue to see that, NCDs are surpassing estimates that we had for them in about 20, 22 years ago, which is, a critical factor for us to keep in mind as we assess the rising trend of NCDs. And as at that time in 2000, the aim was to have a strategy that would support governments to increase their action on health promotion. So the strategy was developed to promote healthy lifestyle among the people of the African region. I would just pause here to also flag that we now know that beyond promoting healthy lifestyle among people, there's also the need to make sure that the environment in which people live can support that healthy lifestyle. At this phase, I imagine that the focus was on focusing on health promotion, but now governments are duly informed that beyond promoting healthy lifestyle, beyond health promotion, there's a need to support with policies that enable people to adopt a healthy lifestyle. So we will, and in that category, we think around things like, being able to exercise, having access to healthy foods, having sustainable food supply chains, having access to healthcare. You might have a healthy lifestyle and still come down with a non-communicable condition. If you don't have access to a hospital where you can be treated, then all your efforts will go in vain. So the shift has moved now from making people take accountability to governments also strengthening their action on non-communicable condition prevention. And I've also captured here some of the objectives that they hope to achieve, through this strategy in 2000. I found it interesting that, as at 2000, WHO Afro saw the need to protect the poor and marginalized populations, and they acknowledged that, NCDs often go hand in hand with comorbidities. Sometimes people start with just one condition, and along the line, they have eye conditions, they have renal conditions because of their non-communicable diseases. So it was good to see that, even as early as 2000, the challenges with NCDs were clear, to the policymakers at that time. If I may have the next slide, please. The next slide describes for us the global landscape in terms of policy for non-communicable conditions. So in 2013, the WHO member states agreed to launch what we call the NCD Global Action Plan. And this Global Action Plan put forward 9 voluntary targets for governments to seek to achieve by 2025. So you would see to the right of your screen 8 different actions that government needed to take. And ultimately, the aim was that these 8 actions would help governments to achieve the 9th goal that you see on your left, which is to reduce by 2025, was to reduce by 25% premature mortality from NCDs by 2025. So this was the policy landscape in 2013, as agreed by governments. The interesting thing is that by 2019, just before COVID, there was an assessment of progress made towards these targets, and government found out that they were not on track. So the decision was taken again that WHO should extend these targets to 2030, and that government should now work towards achieving a 30% reduction in premature mortality. So now it's the 30 by 30 NCD targets. And this is very related to what I also have in the next slide. If you could just give me that, please. Thank you. So many of you will also recall that in 2015, we launched this, the SDGs, and there's the target 3.4, which is to reduce premature mortality from NCDs by 1/3 by 2030. So now we now have an alignment between the SDG target 3.4 and the WHO Global Action Plan targets. And I think this is interesting because now governments know that, we are all, the timelines are aligned. So efforts can focus, in one direction. And, it's interesting that when we look at achieving the target 3.4, in 2015, it was agreed that there are a few things that would drive progress. And if you look at the first one, at the base here, we have the need to strengthen the role of FCTC. That's the agreement to tackle tobacco use in countries. And then there's the need to increase access to medicines and vaccines. There was also a recognition for the role of the health workforce. And there was the need to manage health risks at that time. It's interesting that, even in 2015, the interlinkages between things around tobacco use, around alcohol use, around access to medicines was clear, in terms of their relevance to achieving the SDG target 3.4. If I could have the next slide, please. You see that, as I've shared over the past 2 slides, we've had significant progress in terms of the policy landscape. And this slide also describes what we have seen between 2015 and to date. So in 2018, member states again came together for the 3rd high-level meeting on non-communicable conditions. They adopted a very powerful political declaration. In that 2018, we saw for the first time that member states recognized mental health conditions as a major non-communicable condition, as a major NCDs, and they recognized air pollution as a major risk factor. So that was a landmark, that was an important meeting for us as advocates on NCDs. In 2019, there was a high-level meeting on UHC where NCDs again were recognized in the political declaration, which was really, really wonderful to have. And then in 2020, COVID happened, but we were glad to see that at WHA level, that's the World Health Assembly, and at the level of the UN high-level meeting, 2 resolutions captured the importance of tackling non-communicable conditions. And so we were glad to see that that was also recognized. And then I won't want to bore you more, but even at WHO level over the past 2 years, we continue to see member states show interest in the NCD agenda item. So there's an understanding of what needs to be done, to tackle NCDs. But as this translated to action or progress for us in Africa, my next slide will show us where things stand, and I'll lead you to George on that. So when I was doing the research for this particular presentation, it was a bit worrying to see that things haven't particularly improved over the past few years, and it's not just in Africa, but even for the global, at the global level, things continue to be disturbing. For example, in 2020, after all the high-level meetings and all the policies, the WHO announced that most countries were not on track to achieve their target 3.4, and this was even before COVID. And to bring it down now to Africa, where which is the focus of our discussion today, NCDs they are on track to become the leading cause of death by 2030. As a matter of fact, in some countries like Mauritius, Namibia, and Seychelles, they are already causing between 50 to 88% of deaths, meaning that in these countries, for every 10 deaths, 5 to 8 or 9 of them are due to non-communicable conditions. This is a switch in what we had in the years past, where we had death from infectious conditions. So, we need to continue to strengthen our actions on NCDs in the African region because they are on the increase, and it's a very disturbing trend. To also help us understand the figure, I noted also that in 2000, NCDs caused 24% of deaths in the Africa region. But in 2020, by 2019, they caused 37% of death. And this was before COVID. This was before we had the lockdowns, the limitations in access to hospitals. So you can only imagine what the next predictions would bring in terms of what we have in the African region. And as I said earlier, they continue to cause significant ill health, a significant disability, and premature death in the African region. So just to begin to wrap up now, if I may have my next slide, please. In 2020, we stepped back as the Ncd Alliance and we analyzed the evidence we have from research, from the academia, and from people living with NCDs. We combined all the information we had with them, and we looked at the global NCD response now, at the global landscape, and we identified 5 major gaps in the global NCD response. There's a gap in leadership, as I've mentioned earlier. There are several agreements, there are several policy commitments, but we are not seeing it in terms of action at the country level. We also identified the care gap because many people continue to struggle to access essential services for non-communicable conditions. Many advocates continue to complain about the kind of care they access when they go to the hospital. We also identified the accountability gap. This is important because many of the risk factors for NCDs, they are not managed by the health system or the health sector in countries. We have unhealthy diets. We have things like fossil fuels. Many of these are managed by the private sector, and they have huge resources to manipulate government policies. So we found that in many countries, accountability, holding these industries accountable continues to be a challenge for governments and advocates who work on non-communicable conditions. Apart from leadership, care, and accountability, we also identified the investment gap because non-communicable conditions continue to attract very limited funding from donors. And we identified the community engagement gap. Unlike what we've seen for infectious disease communities, the understanding of the needs of people living with NCDs continues to be a challenge, when we look at how policymakers engage with them. So this is a snapshot of some of the gaps we identified in the NCD response. I also added a slide, if I may have the next slide, please, to share with us, to deep dive now into the care gap, which I imagine is quite relevant to many of us who have come from the health workforce today to join us. So, when we asked our advocates and, other stakeholders around the care gap, it was clear that health systems need to be reoriented to integrate NCD prevention and care. Then the life course approach, understanding that NCDs can actually start NCD's risk factors can actually start from when a child is in the womb and they can continue till the end of life. That life course approach was missing in the way we approach NCD care. And of course, as many of you are aware, health systems are unprepared, they're underfunded, they are ill-adapted to respond to complex care. And this continues to be an issue for people living with NCDs. If I may have my final slide now. Now, bringing it back home to many of us who, like I said, are from the health workforce, everyone can actually take a bold step and make a change in the for the NCD response, particularly in the African region. I'm speaking now to pharmacists because I'm a pharmacist. I hope this will not, be an issue, but particularly for pharmacists, and looking back at my own experience in Nigeria, pharmacists are uniquely placed to amplify the needs and views of people living with NCDs. My current role as an advocate, when people tell me, that they have challenges with accessing medicines, I understand because I recall people coming into the pharmacy and getting the bill for their medicines and saying, oh, I can't afford everything. I'll buy the one for hypertension today and I'll come back for the one for diabetes tomorrow. Those things broke my heart because I knew they needed everything, but they just had to prioritize because they had other pressing issues. So every time we don't have universal health coverage for people living with NCDs, people pay with their lives, in order to access health. And it's a very unfortunate situation. Apart from amplifying the views of people living with NCDs, we can also engage in multi-sectoral partnerships for NCDs. There are different discussions going on. This is a good example of one. It will be good to continue to see health workers engage in these discussions and amplify what they know in terms of what needs to be done for non-communicable conditions. And, looking also into the kind of care that people living with NCDs need, we all need to work together with people living with NCDs, noting that they are equal partners. They should have the opportunity, they should have the chance to co-create with health workers the kind of care they would like to access. And that's something that is important for us to take away from this session. Apart from, co-creating solutions with people living with NCDs, there's a role of, we can also partner to ensure increase in access to affordable medicines for NCDs, even as we, do our work as pharmacists. And I'll just wrap up by saying that, our training needs to continue to evolve. So many things are changing rapidly. We need to understand that, we need to keep up with the new trends in managing NCDs to be able to grant to be able to give quality care to the people we serve through our services. And I think that's my last slide. The last one just says thank you. I thank you all for your attention. I'll give you back to Mary Claire now. Thank you.
Thank you, Tolu, for getting us out of the gates in a huge way with key, not just background information, but also call to action, which, despite you saying is from a pharmacist lens, I believe it cross-cuts all people who deal with non-communicable diseases. And that takes us now to our first poll question. We have 5 poll questions this afternoon. The first one is basically just asking, are Africa healthcare systems built to tackle the looming NCD crisis in the next 10 years, so by 2030? And please be as honest as possible for these polls. We will be sharing the results in a few. And yeah, despite us getting facts this afternoon and possible solutions, share your honest opinion. And as you're sharing your honest opinion, we head over to the second speaker of this afternoon, who also has been working in the pharmaceutical industry, but specifically medication production. And this is none other than Mr. Anthony Mwangi, who is the cluster head of Novartis. So since the year 2020, Mr. Mwangi has been the cluster head of Novartis East Africa, and the East Africa region in Novartis spans across Kenya, Ethiopia, South Sudan, Tanzania, Uganda, and Rwanda. He currently leads a team of more than 130 employees in the East Africa region and drives Novartis businesses through 25 distributors across East Africa. Prior to being the cluster head of Novartis East Africa, he was the Novartis Neuroscience franchise head for East Africa and head of Horn of Africa business, and having joined the organization in 2013 from AstraZeneca, and has a collective of 20 years experience in the pharmaceutical industry in East Africa. I think this will be an interesting tangent of presentation of setting the floor for Mr. Mwangi, considering the Africa CDC also said a key solution to our health system problems is working on local production of vaccines, therapeutics, and diagnostics. So welcome, Mr. Mwangi.
Yeah, thank you so much, Dr. Claire, and good afternoon, good morning, everybody, depending on where you're joining us from. I hope you can hear me loud and clear, Dr. Claire. Thank you for that kind introduction. And I feel like after Tolu has spoken, I have no role to play because she has pretty much covered everything that maybe we were looking forward to hear this afternoon. But I'll definitely give my perspective as introduced by Dr. Claire from the lens of someone who has been in the pharmaceutical industry for the last 20 years, interacting with the healthcare ecosystem across East Africa region, and building up from everything that Dr. Tolu, Ms. Tolu has said, and especially the stark reality in terms of the statistics of the non-communicable disease. I mean, we all agree that definitely this is a big pandemic, and maybe with people, the different actors, the healthcare system have not made enough noise, or we've not amplified this particular subject maybe to a level that it deserves. From where I sit, first of all, I would like to say that as the cluster head for Novartis for East Africa, and I believe our global heads share the same sentiment and commitment to play our role as actors in the healthcare system when it comes to improving the management of non-communicable disease, so that ultimately, we can move the needle and improve the lives of our people. Going by those statistics, you can imagine the impact of the mortality that is, impacting people in Africa out of non-communicable disease. Having said that, I would like to say, as a pharmaceutical company, and from where I see, the way I see it is that, if we are going to figure out solution and improve management of non-communicable disease, it will require concerted effort. So it has to be. Can you hear me, Claire?
Loud and clear, Mr. Mwangi.
Fantastic. Yeah, it will require concerted effort by the different actors. So partnerships become extremely critical. I don't think there's any one single entity or player that can fix or provide all the solutions required in this space. So a very holistic approach. And when you talk about holistic approach, again, thinking about the patient, I mean, it will require an approach looking at the entire patient journey. And what do I mean by this? When you look at the journey of the non-communicable disease patients, I think the bulk of them are still out there in the street, moving, going about their business of the day, and they have no idea that they could be ailing from some of the diseases we are talking about, whether it's diabetes, hypertension, cancer, name it. So even before they come to the hospital, because sometimes I think the conversation can be minimized and narrowed down to just when the patient present themselves to the hospital. So I wanted to highlight key 3 areas that I believe can be a true game changer in improving the management of sickle cell disease. And the first one is, and I've seen this happening quite a bit, but there's more work to be done. It's the disease awareness, and if you like patient education or general population education on this big subject of non-communicable disease. And the impact I see that would come out of this would be, improved health-seeking behavior. I think where I come from, the village I come from, people rarely go to the hospital just for routine screening. And that's how we end up with so many people, with this type of ailments, and yet they are not on medication. Again, there are, stark statistics to support that. But with increased education, disease awareness, demystifying some of these disease, creating awareness on the fact that these diseases are treatable in those setups would really help. And Tolu also didn't mention about sometimes it's not even about treatment with medicine per se, but lifestyle modification. So I think that's an area that I feel if a little bit more emphasis and focus is put, can have a positive impact. The second one is deliberate and very, very intentional commitment, in the space of capacity building. Capacity building in 2 ways. One is, of course, the human resource. And when you talk about primary care medicine, you're talking about maybe at the medium, at the bottom of the pyramid, not necessarily, high-end big hospitals that have infrastructure and have doctors and consultants and so on and so forth. I'm thinking about setups where, level 1, level 2 hospitals, depending on how they are referred in different countries. But that we must put a premium focus there in terms of upskilling the healthcare providers, whether it's the nurses or the general practitioner that works there, so that they're able to, diagnose this patient when they present themselves. And talking about diagnosis, then again, there has to be very deliberate and intentional commitment to resource these facilities with basic infrastructure. I'll not be surprised if you go to some remote part of Africa and, things like BP machines don't even exist. And here we are talking about, improving management of non-communicable disease. And as a matter of fact, in the recent past, I've really come to appreciate the role played by the healthcare providers at the lowest cadre possible that you can imagine. These are, for example, in Kenya, we call them community health workers. I was in Uganda 2 days ago. I think they have a different name, village team something. And then traditionally, these guys, they've only been equipped to support the management of communicable disease, malaria, diarrhea, and so on and so forth. But I see a lot of value in empowering these people, even if not to diagnose, but at least to be able to raise their suspicion index, when they're interacting with communities at the lowest level possible, and refer them into the healthcare system for review. Last but not the least, before I hand it back to you, Claire, because I'm cognizant of the limited time that we have for this session, is, and this one I'm speaking because I've been in the pharmaceutical sector for the longest time, it's then the treatment optimization. And when we think about treatment optimization, for me, it's timely, availability of quality and affordable medicine for these patients. And these again will call for innovative and responsive business models by, for example, the pharmaceutical companies. And again, still on the treatment piece, for non-communicable disease, I think the other big challenge that I've come across is adherence to treatment, because a very good number of patients, they are diagnosed, put on treatment, but I think in some cases, 60–70% of the patient are not adhering to treatment, and that also would have a negative impact on the expected clinical outcomes. So that will be my quick highlight on this exciting topic, Claire, and thank you for inviting me. I'll be here for more engagement, but in the interest of time, I'd like to hand it over back to you.
Thank you, Mr. Mwangi, for bringing up the element that non-communicable disease management is not just a doctor, pharmacy, nurse affair. It involves even people who are involved at the primary healthcare level, which are your healthcare workers. For those in Kenya, that's the term we use. And it takes us back to public health. And I think the common question we used to be asked in that unit of us used to be asked in University of Nairobi, and this is regarding health systems building blocks. So we would like to know from the audience and even from the panelists, which of the WHO health system building blocks need the most investments with regards to NCD management in Africa. Remember, our theme for this session is solutions towards managing NCDs from a primary healthcare lens. So we really need to know where we're going to focus that money on with regards to WHO health systems. So as you're making your choice, this now gives me the floor to introduce our last, but certainly not least speaker, and change gears a little bit, because our last speaker is actually a general practitioner based in Tanzania and is none other than Dr. George Musengi. So Dr. George Musengi is currently a governing council member at Ncd Child, and he has a vast experience in non-communicable diseases and research. A super summary of his bio, because of the interest of time, is he is the founder of Tanzania Young Researchers Forum, and he has served in various roles in the African NCDs Network Secretariat, as well as in 2016 founding and current still chairing the Young Professional Chronic Diseases Network Tanzania chapter, or YPCDN. I'm sure a few of you are familiar with that particular organization. And he is also a member of the WHO Civil Society Working Group on Non-Communicable Diseases, where he currently serves as a co-leader of the Advocacy and Communication Steering Group. So without further ado, we'd like to welcome Dr. George, who will give us his snapshot on what he thinks we could do solution-wise regarding non-communicable diseases. So welcome, Dr. Dr. George, can you hear us? If not, probably you're allowed to switch off your video for better audio. But in the interest of time. Yes, George, we could hear you, but you're breaking off. I will give you the opportunity to talk in the panel discussion, just as we figure out your technical difficulties, so worry not. In the interest of time, as you see, this topic of non-communicable diseases is quite heated, if I can put it that way. We have had a lot of negative statistics after a lot of gaps in management, after a lot of where policy is, but where policy isn't. So now we need to discuss the topic of the day, which is possible solutions to non-communicable diseases from a primary healthcare lens. And the first question will be to all the panelists, where I really want to hear from your point of view and from your expertise. Tolu started the discussion right off the bat, giving us a lot of global and regional statistics on where the gaps are. So we have a lot of global statistics, regional statistics. When I set up the floor for this discussion, how do we hone it down to our local context and get solutions to those problems. So I think I'll start off the discussion with Tolu because she gave us a lot of those discussions, a lot of those statistics.
Sorry, Marie, can you hear me?
Oh, yes, George, we can hear you.
I've just tried to reconnect because I thought you were not hearing me. So I'm not so sure whether I can proceed or what has convened.
Yes, I don't know that you had my question. So you could introduce yourself in a snapshot and what NCD Child does, and then you could answer the question fast. I don't know if you got it.
No, I was reconnecting. I didn't get your question, but please, you can tell me about the question.
So just to recap, you will introduce yourself, you will introduce what NCD does, NCD Child does in context with Africa especially. And then the first question off the bat is we have a lot of global and regional statistics that are most of the time on the negative lens, but we really are discussing today solutions on how to bridge that gap. So how can we bridge that gap, and especially bridging that gap from a local context? So over to you, George.
Thank you very much. So as earlier introduced, I will not go towards the introductions again, but I am here representing NCD Child, which is a global coalition. It was formed in 2011 after the first
George, we are losing you most probably due to your connection. So if you allow me, George, if you'll allow me, I'd like to go to the next speaker as we sort out your technical challenges. So sorry about that. Probably Tolu, maybe Tolu, you could take question number 1 off the bat, since you gave us most of those nice statistics.
Or not so nice statistics. We look forward to better days. But thank you so much for the question. It's a very important one because it allows us to reflect on what has worked so far and what we need to do going forward. And I think one of the things I would like to put up front is that the unique thing about non-communicable conditions is that everyone can do something meaningful. And so when we talk about non-communicable conditions, we say it requires a whole of government, whole of society, and health in all policies approach. And this means that when we look at the society from our community leaders, from health workers, from individuals like us, everyone can do something meaningful for non-communicable conditions. Like I mentioned earlier, in the past, we focused on making individuals take responsibility for their health, which looks at things around tobacco use, alcohol use, physical inactivity, health-seeking behaviors. Those are some of the things that can help us to, change the statistics a bit. Imagine if every one of us here today leave this webinar knowing that, as a female, there's a cervical cancer vaccine that you can take to protect you from cervical cancer in the future. If every female understands that they can check themselves 2 or 3 times a year to check for signs of breast cancer. If every male, every female understands that they can, walk into a hospital and have their routine tests done once or twice in a year. These are some of the things that we can do to also take power back and, be in charge of our health going forward. And this is very relevant for non-communicable conditions. Many of them are called silent killers because you don't even feel anything until you have become severely sick. People walk about not feeling anything, and the next minute they've had a heart attack, they've had, a diabetes crisis. This is because NCDs slip into our lives and they grow while we go about our daily activities. So, you know, in terms of what we can do, every one of us should be conscious that they're on the increase. Every one of us should have a health-seeking behavior. Let's do things that can make us healthier, and let's, you know, collaborate with other stakeholders to encourage those who don't have information. You know, when we move from our cities to our villages, there's a digital gap. And that means that the information we have for NCDs, not everyone will have them. So let's look at opportunities to collaborate for things around medical outreach, where we can tell people, oh, you know, there are non-communicable conditions, they're on the increase, and we need you to know that this is where you can find help if you feel any of these symptoms for non-communicable conditions. So I really hope that this is helpful, but let me know if you'd like me to share some more, Mary. Thank you.
Definitely. And I like where you have answered, how you've answered this question, because we will be diving deeper into that answer. I'd like to hear from Mr. Mwangi, especially from a pharmaceutical lens, how probably with your experience working in pharma and also with Novartis, how we can get this conversation down to community level, especially with what you mentioned a little bit earlier on preventative steps. So over to you, Mr. Mwangi.
Yeah, thank you, Claire. And maybe just to build on to what Tolu was saying, and maybe as I respond to your question, Claire, like I said in my earlier presentation, I think that effort has to be concerted, because what I've seen, you know, we have many actors in the healthcare system, and, you know, they are all doing their small things, their small ways. So first thing first, I think if we can enhance the partnerships that exist from different stakeholders, I think that would be key. Resource allocation, for example, if you think about the government, which is the biggest actor in this space, I think the Abuja Declaration required, you know, an allocation of about 50% of countries' you know, GDP to the healthcare sector. But I think most countries in Africa, I don't think there's even any country which is doing 10%. So, and the implication of that then is that, you know, the resources that trickle down to the lowest level of the healthcare system are very meager to drive any meaningful initiative. So partnership has to be there, the resources have to come. And the other key thing that then will be critical, if you think about you know, empowering the guys at the lowest level of the healthcare system, you know, the community health workers and so on and so forth. I mean, there will be timely intervention of the non-communicable disease, but they need the resources. They need the resources to do that. So I would like to flag out, you know, partnership as a key driver, and which can drive impact at the lowest level. And of course, calling upon the different governments across Africa to, again, you know, revisit and the commitment to allocate more resources so that meaningful initiatives. I talked earlier about, you know, when you think about in the villages, basic screening, you know, for non-communicable disease, they are non-existent, and those can easily be fixed if there's goodwill by the different government across the region. And one more point that I see would add a lot of value by having more emphasis at the lowest level of the healthcare system. It's mining data, because we always talk about, I think, data, the available data in the healthcare system it's really wanting. And data ultimately informs resource allocation. So even the 15% that we're talking about, maybe more would be required to really drive meaningful impact in the healthcare system. But in the absence of data to say, to drive a compelling, you know, reason why more resources need to be allocated in the fight or in the management of non-communicable disease, you know, that would be needed. So we need registries, we need real-world evidence data, which can be used in different platforms, including payers. You know, the National Health Insurance Fund, for example, if they can be, you know, engaged with data, compelling data, I'm very sure they'll be more than willing to provide more support. And ultimately, all these initiatives in their different ways will move the needle when it comes to management of non-communicable disease. Dr. Claire, back to you.
Thank you, Mr. Mwangi, and thank you, Tolu, for those amazing answers. It's actually even bringing up key elements that Africa Health Business discussed in their open-ed that came out earlier this week on reinforcing the new public health order so as to bridge the gaps in NCD management and prevention. I would kindly request, if your internet bandwidth is strong enough, Mr. Mwangi and Tolu, you could have your videos on just for this panel discussion. And also, I would like to see if George, his technical issues have been sorted. If not, he is free to type his response quickly on the chat if he's in a position to, and we keep the conversation going. So Tolu and Mr. Mwangi, you have talked about jointly. Sorry, yes, George, can you hear us?
Yes, I can perfectly hear you. I think it's high time now we need to call for discussions also to have all fibers in every home in Africa. So yes, I'm not so sure if I am quite audible now. Can I give a bit of my response just in a nutshell?
Fantastic. It's much better. So feel free to go ahead.
Marie, can I give my response?
Yes, George. Yes, George. You can go ahead.
Yes. So just taking it from just yes. So taking it from a bit of a summary and from what I wanted to say. So there is quite an overwhelming expectation, especially from the public, towards our governments, and I think the role needs to be switched right now. Communities need to be actively engaged, especially in known diseases. There are a lot of social indicators and social factors that can be taken and measures that can be taken by communities approach in eliminating and reducing the burden of non-communicable diseases. Things such as reducing smoking, such as stopping or reducing the excess use of alcohol, physical exercise, having an understanding of what we're eating and in what quantities we should eat, are some of the key, I think, key measures that need to be taken by our communities, and actually are cost-free measures as supported by WHO baselines, in which we can all implement on our community level, from our individual to families and towards the national level. And taking a consideration in this, I think the burden can quite switch towards what we want our governments to do in terms of rather than preventive but curative, towards what we can do in terms of the preventive. Thank you, Marie.
Fantastic. Thank you for that, George. And since we still have you online, I think I'd like you to comment on NCDs from a child perspective, because that's a discussion we rarely have globally, let alone in the Africa region. So probably you could highlight on that, because I mean, we also need solutions aside from 30 to 70 years old that Tolu told us at the start. We need solutions also for people who are of the youth demographic. I'll use the UN youth target of 25 and below. So do you mind giving us a comment on that?
Yes. So actually, this bias towards the age group has been there even from higher levels. We see a lot of WHO documents coming up when they speak about NCDs. They would hide, but we have a lot of children who are born with cancer. Some of the major countries in the world, such as some of the leading countries in the world, with some of the comorbidities include childhood comorbidities, such as obesity. Highly ranks one of the biggest problems, especially in the American region, and also coming up in the African region. So there's a lot when it comes to children and NCDs. And as I was introducing earlier, I took to note that the UN Convention for the Right of the Child has earmarked a lot of things. And since 1989, when we had the first UN high-level meeting in 2011, it was understood and it came to the sense that there was no coalition in the world that was advocating for the young children and the young people's advocacy agenda for non-communicable diseases. So it is true that children, as highlighted in the UN Convention, note that we are the ones who need to protect these children, but also towards their development of some of the attributes and the behavior patterns which future lead not only towards the risky behaviors, but also some of the things that they do right now will impact them in the future lives. So we are the ones who actually shape some of these behaviors. Plan International had actually highlighted that some of the main risky behaviors that are being undertaken by the young people at the age of 30 and under started at the age of 15 when they were adolescents. So it is quite very important for us to advocate not only for their rights, but to have them engaged, actively engaged and actively included in our decisions, but also in our discussions. And maybe even this discussion would have an invited young person under the age of 30, under the age of 18, to highlight how important they are, not only for the current generation, but also for the future generation.
Thank you. Fantastic. I mean, you've given us some food for thought on who to be inviting for our panel. So I'm pretty sure we will consider that. And this is now, I think, the next question to all panelists. And I would like us to probably discuss about it a little bit more. It is something that also George has mentioned. We are barely talking about obesity in our African children, or even diabetes in our African children, probably brought about by poor nutrition, probably brought about due to financial, social, economic situations at home. And also, one of the key things I've noticed in this webinar since we started is Tolu mentioned there are 5 NCDs, but in our discussion so far, the 5th NCD has only been mentioned when she was saying it, which was mental health. And my question basically to all the panelists is, and I'll start with Tolu, is, I mean, even amongst the NCDs, we're not discussing each of them with equal measure. So what measures can be put in place? Because a topic like mental health sometimes is seen as very un-African. A topic like cancers is only discussed when probably you're affected, especially childhood cancers. What measures can we put in place to ensure the discussions on non-communicable diseases are getting, probably, it's impossible, but I'm pretty sure it could be, but what measures could we put to ensure all NCDs are equally highlighted and equally invested in? So we'll start with you, Tolu.
Thank you very much for that. Very interesting question. And to be honest, we also noted that our minds are still adjusting to the move from the big four. The big four used to be cancers, chronic respiratory conditions, cardiovascular conditions, and diabetes. But in 2018, mental health was added as a 5th major NCD. So a lot of times you need to remind people that, oh, we've moved from the big 4 to the big 5. But in terms of what we can do, and I think, again, I would like to think of communities as people that are powerful. Many of us have the opportunity to demand for more accountability from our government. And I say this because obviously governments have the role to ensure access to health for their people. Now, I don't believe in free healthcare. I don't believe it's not available anywhere in the world to start with. Everybody pays in some way. All the systems we see, the systems that we talk about, so everybody pays in some way. It's either you are paying a little tax every month, or you are in a formal contribution where you have to make a contribution. But the onus lies on governments to organize people into these formal fund pooling systems, and then use the funds they put together to provide access to healthcare. And it is done in a way where the risk is shared equally. Those who earn more are supported to pay more. Those who earn less are allowed to pay less. So my first point in terms of what can we do to change the narrative, not just for non-communicable conditions, but for mental health. First of all, let's know the global trends. We know from today that they are increasing. Premature mortality is increasing. The next step is, when next we engage with our governments on the margins of elections, at the community level, in meetings, in our day-to-day lifestyle. We're all very powerful people. Many of us have friends potentially in the Senate, in the House of Assemblies, even community chairmen. We can tell them, what can we do about non-communicable conditions? How can we put this in your agenda as a leader over the next few years? Let's help them to recognize them for what they are, and let's help them to take action. So if you ask me, what can we do? Let's help our governments to stay accountable. This also means that at some point, we should also be ready to make contributions for our health. in whatever capacity we can manage, because there's no free healthcare anywhere. So for me, it's about encouraging governments to be accountable and being willing to respond when there's a call for us to pull funds together to support health system strengthening at the country level. Thank you.
Fantastic, fantastic. Mr. Mwangi, any insights on this question?
Yeah, very quickly, Dr. Claire, I'll have some 2 points to put across on this one. And we think about amplifying, this particular subject matters, non-communicable disease. I do a lot of, I see a lot of value, for example, in what you guys are doing. These are the platforms we need to speak more about non-communicable disease. But when I look at media, including social media, a very powerful tool through which we can amplify the noise about non-communicable disease. What are they? What are they not? Demystify some of them, because in some communities, disease like cancer, there's still a lot of issues around discussing cancer openly. But the more they can be put out there in local, radio stations and stuff, and broken down to a language that the common man and the common woman on the street understand, I think that would really help. Another critical stakeholder that can really help in amplifying the voice about non-communicable disease is the civil society and the patient groups, because these are chronic ailments. So if we can have, with the support of different stakeholders, empowered civil society, empowered, well-organized patient groups, I find them very, very impactful, even when they engage, for example, the government entities. And last but not the least, again, going back to what you're talking about, the data story, because I think, for example, if we need the government to do more, we need health economics data to demonstrate that if we don't intervene early, when it comes to non-communicable disease, what happens, the impact of that is that, the patients then show up in our healthcare facilities a bit late with complications, and it costs even more to manage them, and ultimately they strain the healthcare system. So there's value in putting in place resources at the lower level of the healthcare system, so that these patients can be caught early, and the management becomes easier with better clinical outcome and even better impact into the economy. That's a language which is quite palatable to our government, as you can imagine.
Thank you so much, Mr. Mwangi. Those are key messages. The element of patient support groups. Many a times non-communicable diseases, someone with diabetes or hypertension believes that the pharmacological agent they are taking will help with treating their non-communicable disease, and they forget something as important as lifestyle modification, which are some of the topics discussed in these live support groups, go a long way in managing their diseases. Without further ado, I'd like to give George the floor to answer this question. And then in the interest of time, I will go to the last question, and then we head over to Q&A, because there are very nice questions in the Q&A, which also will guide this discussion. So over to you, George, about this question. George? George, if you are not in a position to answer, probably you could text it to everyone, just in the interest of time. So,
leap of faith in believing that my network as I was saying, I quite think that the burden will be very different, especially in the future, taking to note what actually is the existence of each comorbidity. So quite equal. A good example is
all right. We have unfortunately had George dropping off, but we hope he'll be able to engage probably in texting. Just in the interest of time, I apologize. And this leads me to, I guess, how I will take us to probably the last question before we head over to Q&A, because they're really nice questions in the Q&A section. From what I'm gathering in a nutshell is it's taking us back to Tolu's slide, which was telling us on the importance of leadership, the importance of care gap, the importance of accountability, community engagement, and investment. And it also runs parallel with what the new public health order is also emphasizing on: the need to strengthen regional institutions, the need to beef up local initiatives on production of, in this case, therapeutics and diagnostics, the need to invest in your workforce, not just the key pillars, but even community health workers, because we have a lot of people who are still community health volunteers and they do stellar work with managing NCDs. And also the element of having a greater role of your regional organizations, like let's say the Africa CDC, in not only pandemic governance, but also the element of NCD management in this pandemic era. And now this leads me to probably what I would say is my last question regarding this particular panel discussion. And it is a question I will try and merge with the section on parting shot, where I'd like to ask all our speakers to give us probably one key message in 2 to 3 lines on your solution to bridging the NCD crisis from a primary healthcare lens. If you met Dr. Tedros, the Director General of WHO, and you are given this question, what was the one thing you'll tell him for him to implement? So we'll start. Now, I won't start with Tolu because that will be predictable. I'll start with Mr. Musengi, and then we'll go to Tolu.
Yeah, thank you, Claire. So first of all, thank you for the nice discussion so far. And to your question then, in terms of the key thing that is on top of my mind that can really, change the trajectory when it comes to management of non-communicable disease. And in a way, I said this at some point in my contribution to this discussion. I think that the name of the game has to be partnership. Partnership. Like-minded partners, coming together, bringing, different, skill sets and input into, a well thought out strategy, because as you can imagine, everybody is spending resources and doing different things. How I wish all these many things that the different actors in the healthcare system were well coordinated, in a harmonious fashion. I mean, the impact will be huge. Maybe with the same resources, we will be talking about a different story altogether, but it's never too late. And I know it's not very easy, but I would like to call upon, the different stakeholders in the healthcare system, to really preach this message of partnership. There's value in partnership, whether it's a public-private partnership, partnership with national governments at the highest level possible with the Ministry of Health, partnership with regional governments where we have regional governments, and maybe, for example, in Kenya where we have devolved system of governance. And these are partnership not for different stakeholders to come with prescribed solutions, but like Tolu said at some point, to co-create fit for purpose solutions, because I think different regions, even within different countries, different regions have different problems. There are regions that will say our biggest problem here is diabetes. There are regions you go and maybe the prevalence of sickle cell disease, it's a pain point. So partnership, to co-create fit for purpose solution would be my prescription. And so on Novartis, we are open to such engagement, and we are happy and ready to forge partnership with like-minded partners. And we believe by so doing, potentially on incremental basis, we could see an impact and change the narrative and change the statistics that Tolu was sharing with us earlier.
All right,
Dr.
over
Claire.
to you, Tolu. Yes, thank you, Mr. Musengi. Over to you, Tolu.
Thank you so much. Mr. Musengi has said so much that I have very little to say. I will just reflect on the global HIV response and some of the things that we know from their breakthrough. And I recall speaking to someone who works in the HIV space, and she said to me, the breakthrough we see today was brought about by a combination of recognizing the experience of people that live with HIV, breakthrough in science, and political leadership. And I think if we look at what we've discussed so far for NCDs, I think if we are able to get to a point where we were able to match innovation in research, research for access to medicines, research for managing conditions, research for new technologies. Basically, if we're able to match innovation with experience of people that live with non-communicable conditions, and then match the two of them with leadership, real political leadership, real political willingness, I think we'll get to a point where we'll begin to see the changes we really clamor for as advocates for NCD. So I would say, let's try to, if I met Dr. Tedros today, I would encourage him to try to get those three, and then we'll see how it goes from there. Thank you.
All right, fantastic. So we're now going to head over to some of the fantastic questions that are being asked on the Q&A. But before I do that, I don't know if...
Can I give a response to that?
Yes, fantastic. Yes, go ahead.
So if I would, in a nutshell, say one statement, first of all, I would want to say today's example of my network limitations is actually the actual limitation that people living with NCDs have. They want to speak out. They want their actual faces seen by the public. They want people to know what they're going through, but sometimes they do not know how or what to do about it. So I think this has been quite a good example in my end, and I was just reflecting on how many people in the world want to say these are our concerns or these are our problems, but how or where do they air them to? So one thing that I would note is that communities are the vital and most important place where we need to strategize. Solutions are being based for communities, but actually solutions are inside the communities. Thank you.
Amazing. I think there's a reason why you spoke last, because you are redirecting us to not think global, but think local at the most basic level. And that was our part of our discussion, the primary healthcare lens, the community lens, where we all start from. And with that, I would like us to now head over to the good questions in the Q&A section. I think there's a very stellar question that has been asked. And George, if your network is still permitting, I'd like you to answer it first. Then it'll be Mr. Mwangi and then Tolu. And it's a question from Maureen, who asks, to all panelists, what is your opinion about the role of the traditional doctor in treating this disease? I mean, I think most of the time in the African context, if you're not comfortable going to the hospital, you go to your local doctor to help you out. So yeah, what do you think is their role, and how probably can we tackle the NCD crisis?
So from an African perspective, I think they play a very important role. Most of our, I would say, forefathers, they believed in traditional medicine. And growing up, we come to see modern medicine, which is quite good, but we still have a lot of people actually believing in traditional rather than modern medicine. I have seen a number of patients who come to the hospitals in terminal state because they have been using herbal medicines at excess or at probably unregulated chemical compositions. So I think one thing that I saw one of the doctors in Tanzania was doing is he started an intervention whereby he was actually working with traditional healers and trying to educate them on, when you see these symptoms, just understand that this is a condition and you can direct the patient to me and we can work together. So I think it is very important for collaboration, but rather than that, I think it is very important not to sideline them or to point fingers at them, but to work with them hand in hand in what we do.
All right, so don't shun them. Welcome them to the table and to the solution pool. Mr. Mwangi, over to you.
Yeah, I think from my side, I definitely don't want to contradict George as an African child. But having said that, I think, I definitely believe in, evidence-based management of disease. So I think definitely there's a gap when you think about the traditional healers. And the other challenge I see in that space is the regulation. I don't think there's anybody that regulates what they do. So, and we're talking about people's lives here. So for me, I mean, as much as in the past they played a critical role, I would see a lot of value in, as we've been discussing in this session, focusing a little bit more on, and empowering and deploying very, very intentionally more and more community health workers, to engage community and our population at the lowest level possible, because they will have proper upskilling, they will have proper training, and they they'll be able to even, they'll strengthen the referral system of some of those patients in terms of those who don't seem to be improving, or those the suspicion index, look quite high on a certain disease area. They'll be able to really guide them in terms of where they can get more advanced care. So, I mean, mixed feelings in terms of the role of the traditional healers in the past. Definitely, they've done some good work, but I would like to envisage a future where maybe they are completely, replaced or substituted by community, well-skilled and empowered community health workers.
All right, Tolu, any additional view on this question?
Yeah, just to complement that, even at the WHO level, at the global level, there's the role of the traditional health workers are recognized, or the traditional healers rather. But just to also add that we continue to see a gap in how their practices are regulated. Sometimes we need to ensure that they understand the things that they can manage and the things that they need to refer quickly, because like as has been said, these are the lives of people at stake. And then again, the growing burden of NCDs also means that many people would actually appear at their own desk first before they get to the hospital. So I see that there's a role for maybe collaboration between the white collar doctors and the traditional healers to ensure that they understand that these symptoms mean this kind of ailment, and this is a good point for you to refer them to us for better support. So yeah, there's scope for collaboration, but it needs to be managed as effectively as possible. Thank you.
All right, fantastic. And George did mention that people present to these hospitals pretty late, and coincidentally, Mwangi Njeke also asked, the reason NCDs are called silent killers means most people never present for screening early. And while doctors and healthcare practitioners keep advocating for screening, people still don't present in time. So what initiatives can people engaged in primary healthcare for NCDs offer so that people can step forward in time? So I will start the question with Mr. Mwangi. And Mr. Mwangi, you're free to also highlight probably initiatives that Novartis are doing to help bridge this gap. So over to you.
Yeah, very quickly, Dr. Claire, my quick 2 cents on that question would be, we must make an attempt to take these services closer to the people, the screening services. Otherwise, if we keep doing it this way it has been done in the past, where we have these services available in the healthcare setups, and it will take a long time because it will require a complete mindset shift. But if you want to get results faster, take some of these basic services closer to the people. If I can give you an example, I see medical camps, as a very effective way of picking, people who have elevated sugars and BPs and stuff like that. And the moment someone gets to know that my BP is high or my sugars are high, they'll be more than happy now to make the next step and walk to the healthcare facilities for more comprehensive management. And Novartis, we've forged some partnership with some entities here in East Africa, and especially the faith-based organizations. And we through those partnerships, there are some screenings, happening in different parts of the region. for again quite a number of the non-communicables. Not all of them, of course, can be addressed that way. But you think about hypertension, diabetes, eye care, and stuff like that. There's some basic screening that can be taken closer to the people, and incrementally, I think that can have an impact.
All right. So over to Tolu, and then I'll give us like 2 minutes to answer the 2 polls.
Thank you for that question. I think the first step is for us all healthcare workers to understand that NCDs are now the norm other than the exception. I think this change in mindset helps us to encourage our service users to be conscious that they could come down with non-communicable conditions. I don't mean in a scary way where we make it look like everyone is doomed and everyone is going to die. I mean it from a dimension of asking proactively questions around, what do you think about this screening? Have you ever thought about this screening? And I think the best way to go about it is for ourselves to also be people that are health seeking in our attitude. I believe that personal testimonies from healthcare workers on how our experience has been with keeping an eye on NCDs could help to bring more people to understand what they need to do at different phases in their life. So yes, the burden is rising. We need to be proactive about how we engage with people on non-communicable conditions. Like it has been rightly discussed, we continue to see a role for things around medical screening, and this can be organized on any platform. If you're in a church, you can propose, for a medical screening. If you're in a mosque, you can propose the same. If you're in a social club, you can propose the same. So these are some of the ways we can help people to understand how the burden of NCDs is changing rapidly in the Africa region, and also encourage them to adapt, appropriately and protect themselves. Thank you.
Marie, can I comment?
Sure. Fantastic. Go ahead.
So yes, I quite take it to a very, very personal level, whereby I think a large majority of our communities, especially in the African setting, are afraid of the unknown. So one thing, for example, at Ncd Child that we do is we have a young leaders program whereby we empower our advocates or young people from all over the world to be the change makers in their communities. So speaking about primary prevention, but especially from an educational point of view, whereby communities can understand earlier knowledge and earlier understanding of the condition is much better compared to a later diagnosis, which is at many times fatal. So actually active engagement with the communities, but with the focus of educating and actually realizing, creating the sensitivity of understanding what these conditions are and how important it is to have a constant regular checkup. I think it's very important at that level.
All right, amazing. I hope during the course of these answers of the last question from the panelists, we have been answering the final 2 questions of the poll. This now leads me to show the poll results for the first 3 questions, which had a lot of data from our end. So yeah, the first question was, are Africa healthcare systems built to tackle the NCD crisis by 2030? And interestingly enough, 42% strongly disagree. So I think then we were very well in order to have this discussion, and we didn't waste the afternoon. And I hope we remember some of the solutions that we discussed. I will be giving a super summary of what we've discussed in a bit. And then the second question was, which of the WHO health system building blocks need the most investments with regard to NCD management in Africa? And coincidentally, people are saying access to essential medicines needs the most investment at 34%, followed by your health workforce at 25, and then your leadership and governance and healthcare financing closely follow each other at 16% and 13% respectively. And despite talking about point of care and primary healthcare systems this whole afternoon, the element of service delivery is just at 6%, and it's tied together with health information systems. So I think we probably need to have more of a discussion, because people are pro pharmacists in this discussion or in this poll, or probably something for more food for thought for us to think about. And then finally, we asked which NCD needs the most attention in Africa. Next question. So coincidentally, we have the cardiovascular diseases and the cancers leading the way with 38 and 34%. And then we have our diabetes with 13%, and then mental health at 9%, and chronic respiratory diseases at 6%. And this is particularly interesting given that a good number of cases that were high during COVID were your cancers because of the lack of access for chemotherapy or radiotherapy services when lockdown happened, and then followed by mental health, especially by people who were used to going out and doing activities all day, or even people who are used to staying indoors more than usual. So I think we, as we were saying earlier in the discussion, or as Tolu even mentioned, we need to gradually change our mindsets from the big four to the big five, in line with what WHO have said. And with that now, all good things come to an end, and I need to summarize all the stellar things that our panelists have said. And I think the one phrase I have come up with from all this discussion is nothing about us without us. And this is because we have re-emphasized that people, from starting with what George told us, people with NCDs need to be engaged in the decision-making process, in the management process of their NCDs, in the prevention process of their NCDs, whether those ones who know it and those ones who don't know it. If you're thinking, or if you are exhibiting signs and symptoms of an NCD, you really need to be given the courage to go to your closest health facility and get services. Again, in line with that, nothing about us without us, is the need to have data-driven solutions, that everything we do must be guided by evidence and must be in the best interest of our people. And finally, but not the least, our emphasis in today's discussion was primary healthcare, and primary healthcare starts with the community. So do not forget to engage your communities. As George kept saying, communities, communities, communities. And remember, as you engage these communities, since George was representing NCD Child, the biggest percentage of our African demographic are the youth, so under 25. And hence, we also need to have them in mind when we are designing solutions to tackling NCDs, so that by the time they are 30 to 70 years, the chances of them getting an NCD is relatively reduced. And then for me, on a personal level, my personal lesson that has come up the most is the need for equal emphasis of all chronic diseases, non-chronic diseases. So starting with the one least talked about, mental health, and then using the stats we have today. So it will be your mental health, your chronic lung diseases, then your cancers, then your cardiovascular diseases. And with that, that is it from my end. Thank you very much for attending the webinar. I now hand over back to Victor to tell us what is up next from Africa Health Business.
Thank you, Dr. Marie-Claire. As we conclude the webinar, allow me to quickly inform you about our upcoming events. Next week, Thursday, AHB in conjunction with SIPCA will be hosting a webinar, the role of the patient and the public in combating counterfeit medicines and vaccines. SIPCA is a Swiss company known as the leading global supplier of ink-based security features, banknotes, and value documents such as passports. SIPCA technology is particularly relevant to secure the integrity of the critical supply chains, ensuring the authenticity of the pharmaceutical and medical products such as doses of vaccines or surgical instruments, or key documents like test results and vaccination certificates, among others. Kindly join us this Thursday to get to learn and explore SIPCA technology. To register for the webinar, you can scan the QR code on the screen or click on the link shared on the chat box. And as part of the HB22 webinar series, AHB will be hosting the next 3 webinars. The next will be on July 22nd, Reimagine Building Patient-Centric Digital Health Ecosystems. And the next will be on September 22nd, which will be the Reinforce Expanding Africa's Production of Vaccine, Therapeutics, and Diagnostics. And the last one will be in October 27th, which will be named Revolutionize, boosting Africa's infectious disease surveillance and response capabilities. And lastly, we have our very own flagship project, the 7th Africa Health Business Symposium, focusing on men's health and the role of private sector in advancing men's health in Africa. The men's health event will take place on Thursday, 24th November 2022 in Nairobi, Kenya, and will be a full-day, highly interactive hybrid event, allowing both in-person and virtual participation, welcoming eminent health experts, business leaders, development partners to discuss and share information, and also to provide lessons learned on key areas that affect men's health in Kenya, in Africa, that is. On behalf of the AHB, thank you for joining today's webinar, and stay connected to the email addresses and phone number displayed on the screen. Thank you, and wish